Hello, everyone. Thank you, listener. Hello, viewers on YouTube. Delighted to have you with us today for the next in my series of Mindful Meets. And today I am chatting with the very lovely, the very lively Rachael Wall, who is going to be talking about her life as a PSYCH-K facilitator, which might be something that you haven't heard about before. It's really, really fascinating. In addition to that, she is a systematic kinesiologist. So she's working in the area of complementary medicine. And like all my conversations, Rachael is coming from a place of helping others' well-being. So helping them feel better, helping them think better, helping them live better. And you may know, if you've listened to other of my podcasts, that that is what this podcast is all about. If you have enjoyed this conversation, then please follow, and then you can listen to all the others, and then you will get my regular updates as well. I normally post about 1 or 2 conversations a month, spattered with some of my own musings when the fancy takes me. Anyway, enough of that. Rachael, hello.
Hello.
I told she was lively. This is going to be a lovely conversation. So I met Rachael. Was networking, wasn't it?
Yes, it would have been a couple of years ago.
Yes. There is a pattern here, of course, because the Mindful Clinic business being relatively young, it sort of started at the beginning of lockdown in earnest. Many of the people that I met, many of the fantastic people that I've met and I've interviewed on this podcast, I have met exactly the way I am talking to Rachael now on a Zoom call. So hurrah for online networking. And who says you can't build relationships online?
Definitely, 100%.
Exactly.
Well, ironically, that our lives have never quite. We would have lived about 20 minutes apart from each other years ago. There's lots of people that we know and other therapists that we know, and then we happen to meet networking.
Life is a funny old tale, isn't it? Yes, yeah, it is. So talking about life and twitches and changes and sometimes funny, sometimes interesting moments. Tell us a little bit then, please, Rachael, about how you got into this area of complementary medicine. What happened?
Well, naturally, it was through horses.
What?
Yes.
Oh, okay.
So for me, my childhood was spent at the stables. I competed a lot. And so I was at a competition yard. So people used to get the back man out, and that back man happened to be a McTimney chiropractor. So when I was at school, when we did work experience, I did my work experience with the McTimney chiropractor. I went off to agricultural college, knew that it was something I didn't 100% know at that time I would be training as a chiropractor, but I knew I wanted to do something within the horsey field. And then it was during my experiences there that led me into, McTimney kept cropping up. So for me, I read all about the course and seeing the treatments, just knew that that was the thing for me. So I actually went into training on the human side, the people side, thinking it was actually a means to end for the animal course, because you had to go, because I wasn't already an osteopath, physiotherapy, therapist, vet. At that time, you needed to train in the people course first. So during my years of training then, that was when I then realised actually it was really, I was being pointed in the right direction for the right training, I think. So yeah, during that training and beyond, for me, all of the interest and the fascination was all around people, the mind-body link, the effects that our thoughts have on our bodies, and the signs and clues that our bodies give us. That then meant that, yes, I did train on the animal side. I did practice for a number of years as an animal practitioner. But for me, do you know what? It's all about the people. So I no longer practice on the animal side. I actually deregistered as a chiropractor through other trainings that I've done, that I've found those to be far more helpful, because for me, it's all about helping people with their health, but helping them to take back control of their health and to understand actually the possibilities that are there. And with the right environment, that our bodies have the capacity to heal in a way that sometimes you think you have to live with something for the rest of your life. That might not necessarily be the case. So
yes, and there's so much helpful conversation these days, isn't there, about this, about more of an holistic approach and not treating either parts of the body in isolation, or just having one approach without thinking how perhaps the body connects within itself, to be able to find those relationships between, as you say, mind and body. And I was having a conversation recently on the podcast with Emma Jameson, who is a nutritional therapist, and she was talking about those relationships inside the body between the gut and all the different systems, and how even though it seems like it's quite a long way away, the gut to the brain, it's directly linked. And so having gone then from being a chiropractor, you then decided to explore more of this connection that we're talking about. So tell us about what you found in order to answer that curiosity in you.
Yeah, it was interesting because I trained as a chiropractor in my early 20s, and I've been brought up very much in the medical model. You go to the doctor, you tell them what your symptoms are, you take the tablets, you get better. And then even during my training, there was people in their 40s, 50s, beyond, that had far more life experience than me. And so the key book that was talked about a lot at that time was The Molecules of Motion by Candice Pert. And so I was intrigued because it just kept coming up. And so just my inquisitive side, I then went and read that book, and it just blew my mind because I just never realized these things were possible. And then on our very last lecture before I graduated as a chiropractor, somebody came in and did a demonstration on kinesiology. And I just thought, oh my God, I've done all this training. And this just seems like it's just so much more powerful, because essentially with the main methods that I use, you're having a conversation with your body. Ultimately, your body knows what's happened, what the timeline is, what events have happened, what memories have been held and stored, what's been released and let go of, how the body systems have changed to try and keep you in balance. And so rather than coming from the chiropractic model, then I'm coming from my learned knowledge in order to then decide what I think is the best course of treatment and discuss that with a client or a patient. With kinesiology and PSYCH-K, you're saying, okay, so this is how things are right now. This is where we're aiming for. This is how ideally you'd like things to be. How do we get there? And we're just asking. I'm essentially just acting as an interpreter, to then say, okay, so what do you need to do for lasting change, to help to build from one thing to another, in order to get that change, that health improvement, whether that's emotional or physical, that you're looking for. So
that's fascinating. So kinesiology, then, in a nutshell, how would you define it for anyone listening who doesn't really know what it is? I mean,
Yeah, so kinesiology, because the how you use kinesiology muscle testing is slightly different within than it is within PSYCH-K. In a nutshell, so from your spine, you have all the nerves that are coming out, because the roots, and that's how kinesiology came from a chiropractic knowledge too. So you've got all the nerves from your spine that are coming out, and they're creating the movements that you want within your body. But then there's also nerve supply to internal organs. So you can come in, for example, with a shoulder pain, but the muscles that are involved with that could also link with an organ in the body. And those organs also have emotions that are attached with them. Every area of the body also has its own nutritional needs. So it could be as far as taking supplements that you're needing to boost certain levels, or it can be that there's certain foods that you're eating that are causing inflammation or weakening that area. And then you've got the overlay of Chinese medicine, traditional Chinese medicine over the top. So the meridian systems also connect with the muscles of the body and everything that goes with the meridian and the flow of energy around the body. So using the context of, say, within chiropractic, you get lots of people that come in with lower back pain. What I was noticing when I was going through medical history is you have a lot of people with back pain that also have IBS. Now, within kinesiology, there's a strong link between the two, because all of the muscles to do with the small and the large intestine are around the lower back and including the stomach muscles. So rather than approaching things from you've got back pain, then you can, okay, so you've got pain in this area, and then you can test those muscles, essentially ask the questions of the body, is this an area that needs strengthening? And is it the priority area? That's the important thing within systematic kinesiology. Is it the priority? Because you've got yin and yang within everything. So one area flows into another. So for example, the feed into the large intestine is the lungs. So it might be that it's the lungs that need strengthening, or the muscles around that area that then will help your digestion, your back pain, your physical pain. But it's through asking that you can then you can say, okay, is it the priority? Is it to do with food and nutrition? Is it to do with emotions or stresses? Is it a structural issue? Is it to do with the electrical systems of the body? You just ask the body. It lets you know.
Well, this is fascinating, isn't it? I'm here absolutely riveted. So your role then is to, and how you do this, I have no idea, ask the right questions and then interpret the answers.
Yeah, so I act as an interpreter, essentially. That's my role. So I've always wanted to know another language. I just didn't realise it would be the language of the body.
And it wouldn't help you buy a cup of coffee in 20 countries in the world. But anyway, never mind. Right, so seriously,
you should be drinking the coffee in the first place.
Oh, well, maybe not. Although Frank, from my side, there is nothing like a really, really good cup of coffee. Anyway, that aside, so you're asking the question. So firstly, do you need to have someone in front of you face to face, or can you do this online as well?
It can be done online as well. So obviously face to face, you physically feel the difference as I do the muscle testing. And then, you'll start off where somebody's symptoms are, and then, like I say, you just ask the questions to find out the point of what needs to be done. When I'm working online, I use a pendulum. So there's a process that I can use that helps, which means that I can then show you your own muscle test response as though we were in a room together. So, and that's with the kinesiology as well as the PSYCH-K side.
Yes. So the muscle testing then, so if there is a response, something physically happens. So you just then, because I can see you, obviously, if you're listening, let me explain. So Rachel just held her arm out and she was pushing down. So if there is a response to say something needs attention, and you please correct my words if that's not right, then something happens in the arm. So does it weaken? Is that what happens?
I was using the example of the arm because you can, for those on video, can see it. All of the muscles of your body relate to the movement that it does, an organ, Chinese meridian. So the testing will be determined by the symptoms that you come in with. So just using the example of a shoulder problem, if it was that you couldn't lift your arm up in the air, then that would be the best starting point for, okay, let's just check if it's directly where the pain is. So when you're doing a muscle test in person, literally it's a really gentle pressure. I just use 2 fingers and they'll be on the end of your arm. So the movement being that we're testing that you're lifting your arm up in the air. So then I would say, ask you to hold the muscle strong. So I'd say be strong. You would then resist match the pressure that I'm using. So that's something that when we're working in the room together, we'd talk about, and we'd do a test run to begin with. And when everything's absolutely healthy, there's nothing wrong with that area, all systems are go, then you can repeat that muscle test and the muscle will test strong. If there's something that needs addressing in that area, you say be strong, and as much as you try. And that's the bit sometimes when you think, oh heck no, just try that again. I don't think I was trying. Can we test it again?
Ready.
I wasn't ready. Yeah, no, that's it. So there can be a bit of disbelief sometimes. It's such a gentle pressure can change whether your muscle can hold or not. But if there's something that needs addressing in that area after 1 repetition or 2 or 3, your arm will either it just completely goes or it just starts to weaken. That's then when I then start to ask the questions. Okay, so that's weak. Is it a priority? Yes or no? If it is, then I'll ask, is it nutritional, structural, emotional? I'll ask those questions. Yeah.
Okay.
So if it's not the priority, then you move on to the next area. So now
I see.
Yeah.
So I have a question, and I'm rather going to throw this at Rachel because she's not expecting this. And I'm not asking for online treatment live, while everybody's listening. But I have what I think is tennis elbow.
Okay.
I'm pretty sure it's tennis elbow. So if I came to you with tennis elbow, so online, say, because we sadly live quite far away from each other, so you could ask me relevant questions about my tennis elbow, and we might be able to get to the bottom of it.
Yeah, so this is like really generalizing, because you can't 100% say that where your pain is where it's coming from. But so during the medical history, you literally cover everything, all systems of the body, because they're all interrelated. When you talk about tennis elbow, the first thing that comes to mind for me is stomach. So it would be, and in any case, there'd be lots of questions about the foods that you're eating, your digestion, what that's like, everything surrounding digestion. But then in the testing, we would find out, is it actually directly related to the stomach or not? Yeah, because it might be another area that's feeding in, that where the pain's then coming out. But yeah, so my first thought would be stomach. I would then check those muscles, see if they're strong, weak, priority not. And that can be the stomach meridian. That doesn't mean necessarily that it's the stomach as in your digestion. And it could be just that there's something there that needs to strengthen, because in order to resolve your tennis elbow.
It's really, really interesting. So how does then PSYCH-K differ from kinesiology? Because you mentioned just now that there is a nuance there.
There is. So with the kinesiology, you're checking the muscles that are relevant to the symptoms, or if that doesn't come up as the priority, then from training, you'd know where the next best step is to go asking the questions. Within PSYCH-K, it's all about the subconscious mind, what the subconscious mind holds as memories, thoughts, beliefs, any stresses. And with the PSYCH-K, it's more like having a conversation with your subconscious mind and your higher self. Again, it's asking questions. There's the particular eye position that we use to access the messages from the subconscious mind. If you're working in person with each other, then there's just one muscle that you would use for the testing. You can obviously change sides if one arm starts to get tired or not. But then with PSYCH-K, so you can then use it in a number of different ways. So it could be for a particular pattern that you want to change in your life. It could be to do with kind of things that that are holding you back from getting to where you want to be. And then there's also a health and well-being aspect to often the health and well-being training as well. So that can be a physical condition. It can also be things like anxiety, depression. It can be, Crohn's disease, IBS, as much as it can be a physical pain too. And with that, you can find out what the particular messages are behind a condition, what the subconscious beliefs are that are stopping that condition from improving. And the way that I've obviously used it a lot coming from a hands-on treatment point of view is that often with a physical pain, particularly when it's chronic and recurrent, there's a reason why it's not all about physical alignment. So it can be nutritional, it can be to do with foods that you're eating, but it can also be to do with events that have happened in the past. Or the first enlightenment I had to that actually was whilst I was training as a chiropractor. So I lived in a shared house at that time, and my housemate, she hated her job, as an aside. So she'd come home and she would complain about work and her boss, and she had neck pain. And like in our final years of training, you treat people under supervision. So she was somebody that I was treated. We had 3 sessions together, and within your training, it can sometimes take kind of 2 to 6, can even be 8 to 10 sessions for improvements to really start to come along. So we were 3 sessions in. It was the same response though. After every single treatment, within 24 hours, she was back to exactly how things had always been. So things weren't progressing. Then, as an aside, she came home one evening and said, "Jo, I don't care that I haven't got a job to go to. I've had enough. I've resigned, handed my notice in." So talking about that evening, next morning, popped her head round the door, said, "Rach, you're not going to believe this, my neck pain's gone." And I was like, oh my God, okay, sometimes physical pain isn't physical.
Yeah.
That was my first introduction to it. And within my training, again, I'm just giving examples, it's not always absolutes, but sometimes it can be that there's something, your neck pain can be to do with something that you're not looking at in your life, or there's some form of conflict that their boss perhaps, it could be that they're not looking at a changing job. It could be that the boss was literally a pain in the neck and manifesting as a physical pain. So yeah, it was that in the understanding that a physical pain isn't always physical. So within PSYCH-K, then you can find out what is it, what perhaps subconscious beliefs need to be changed, or stresses. Because, for example, a car accident and you get whiplash, it can be to do about releasing the emotions or the fear or the shock of that accident, then allows the physical pain to improve. So you can still need the hands-on treatment, but it's effective.
Yeah,
after the PSYCH-K sessions. So
yes. And in my work, I know how powerful and sometimes how unhelpful the subconscious mind can be, because it's very often driving those eating behaviors that the conscious mind knows doesn't help.
Yes.
And is causing distress at the very least, and at the worst is really threatening someone's physical and mental health. And so being aware that is such an intrinsic part of how someone is feeling and also how they're behaving is fundamental, isn't it? And also I think it's interesting watching you, listening to you talk about it, how much you obviously get out of taking people to that place where they have the ultimate well-being that you can at that moment provide them with. I mean, it gives you great joy, I think.
I absolutely love it, because I think so many people suffer and they don't need to be suffering. And just to know, to empower you, because just to empower you that things can be better. It's a case of I'm not the 100% the answer for everybody either, but there is hope out there. Things can be different, and just to empower people to know that, it to me means everything. So yeah.
And I think to have the confidence to say, yes, I am going to go down the complementary medicine route. It's not wacky. It's not woo-woo, whatever word maybe you might have heard, or you might be tempted to think. Just try it. I mean, I meet lots of people that are working in areas of healing, working in neurolinguistic programming, people like yourself, working in the area of kinesiology, essential oils, and there are all these conversations are on the podcast, which gives you the opportunity to say, well, what have I got to lose, especially since the NHS is very overloaded, and you might not actually need orthodox medication. You might be able to feel better through one of these other channels, and it's just about having the guts, I think, and confidence and open-mindedness perhaps as well, to say, do you know what, I'm just going to give it a go and see if it helps.
And being the open-minded to try is definitely an important factor, because that's all part of a lot of with recovery, with treatments, is your belief in the therapist that you're working with, the belief in the therapy that's happening, and the belief that things can be better for you. So you hold those beliefs, and you hold one hell of a chance of things being better. Hugely. And like you say, that there's within the NHS, there's some huge and amazing things that it does and it achieves, but it's not always the only answer. And if you've been told through that route there's nothing can be done, it just means there's nothing that can be done using that approach. It doesn't mean that nothing can be done.
Yes.
And a lot of it, with you were saying, with the woo-woo side, is how it's often termed. The woo-woo works. Was it Roger Hamilton? Hamilton, his surname. But the book's just there somewhere to my left.
You can have a look if you want to.
A lot of it is that I will do in a second. A lot of it is that the science isn't there to prove that it works. Like within acupuncture has been around for thousands of years, and it's only, I think, in the early 90s, I can't remember when the research was, that they proved that the acupuncture meridians exist. But through all that time, otherwise, it's you can dismiss it because there's no proof, but sometimes just the science isn't there yet to prove that how it's working. And you know, we were talking about the microbiome earlier, that it's you know, hurrah, it's gaining credibility, but because the science has finally been able to start to prove it's there all along.
Yes.
It becomes accepted in a bigger way when the science is there. But yeah, it doesn't mean it's somebody has benefited from all kinds of treatments at some point. So there's the possibility that they can work for you too. So
yeah. And I think it is also about trust and about patience on the part of the person that's seeking the help, because I know sometimes I get a little bit of eye rolling when I go, right, okay, so now we're going to give the voice in your head a name, and you see people go, what really? And they go, what? But that's me. Well, yes, it is you. But we're going to talk about trying to separate it, externalize it, so that it becomes something that doesn't define you, something that is not so intrinsic inside you, so that you can break those connections of shame and guilt and personal identification. In other words, you know, that it doesn't become a definition of you anymore. It becomes more optional, and then you start to break down that connection. But yes, I get some, not exactly rejection of it or resistance, but I can just see the skeptical kind of hat is going on. I go, no, bear with me, you know. And we do get to a point where we're able to start to dull those subconscious messages that drive that unhelpful behavior, and to, exactly as you say, empower the person, empower you to be able to make the choice about how you eat. And the other thing I was thinking as you were speaking was this idea about the fact that actually just believing that something else is possible must in itself contribute to reducing some anxiety, some stress, and some worry about a condition that someone has. So our role, and I can imagine that you do this beautifully, is about nurture, isn't it? And about taking care and about encouraging that element of positivity in someone, as well as the actual tools and techniques that we give them.
Hugely. Like I said, the words that you say to your, like with what you're just talking about, that just taking a step back and noticing and observing how sometimes even how you're speaking to yourself, because we can be pretty cruel to ourselves. You know, you wouldn't speak to your best friend like it and, you know, be your own best friend in many ways. But yeah, any words that you're saying have an emotion attached to them, and those emotions are either lifting you up or pulling you down. So yeah, if you can note it, like I say, that just to know that things can be different gives you the hope that's a step in the right direction. So,
yes, exactly. And so you work out of beautiful Somerset, don't you? And you work with your lovely partner Lorna in your company, which I'm not sure I mentioned. It's called It's All About Health, and we'll put some links on. But tell us a little bit about Lorna and how you complement each other in your practice.
Yeah, we do hugely. It's evolved over the years, because we've both have that fascination on the mind-body side. And myself, the kinesiology and the PSYCH-K, also do something called visceral release. Well, it's called visceral manipulation, but I think that sounds a little more
slightly scary.
It's a lot kinder than it sounds. I like to say visceral release work. It's like all of our internal organs are held by ligaments onto our bony structures. So your livers attaches into the rib cage and the diaphragm, as an example. So I'm just going to use the car example. I know I am talking about Lorna, I promise. So I'm talking about the
I'm going to tell her that you talked about everything else except her. No.
What Lorna does is amazing too. I will welcome. But yeah, so with the visceral work, you could have a car accident and your seatbelt comes across the front of your breastbone. That can then impact the ligament that's holding your liver in place. So it's more important that your vital organs are working, less important that you can raise your arm above your head, because that's not vital to staying alive. So your body will protect tension, in order to mean that you can still breathe and function and the body can work. So we both do the visceral work, but then also Lorna does scar release work. So that is on what would be keyhole surgery scars, as well as, you know, very visible scars, and also craniosacral therapy. So craniosacral therapy, in that as much as you have a heart rate and you have a breathing rate, you also have a craniosacral rhythm, which is cerebral spinal fluid going around brain and spinal cord, bathing everything, all our nerves, bringing nutrition and taking away waste products. But if there's areas that aren't working fully, then that can build up to cause inflammation and restriction and pain. So with Lorna, she is speaking to the body in a different way, with her hands asking where do things need to be released, and she'll bring into play the craniosacral therapy along with the scar work and the visceral work, and she also does PSYCH-K and kind of brings all that in together, and it works beautifully together, because for myself, when I'm doing a hands-on treatment, I can feel when what I call a cranial neck. I can feel like, I can feel you need craniosacral therapy. Or if you're working with somebody and they've got a huge scar, that's releasing that will then help the physical pain to release. Then what we do really complements each other in supporting each other's treatments, as well as working together really, and helping make sure somebody gets the best of each bit that they need.
Exactly, yes.
Yeah.
So it sounds like for a lot of ailments, a lot of symptoms that we might have, that you would be a really interesting and a really good and a really practical first port of call, in a way, because it sounds like there are lots of things that we might be experiencing that you could help. Could you just give us an index of, you know, the top 10 conditions or symptoms that people will have coming to you, so that we can just tick or cross whether we think we should get in touch?
So in no particular order, shall I say? There's the physical pain, so joint pains, back pain, neck pain, headaches, migraines, anxiety, depression, IBS, but also Crohn's and ulcerative colitis, autoimmune conditions, the menopause. There's so much more to the menopause than the female hormones. And also, just to come on to like food intolerances, and also things like hay fever. I'm just going to give 2 really quick examples on that, if I may.
Please do.
So sometimes things like hay fever, or like particularly autoimmune conditions, can actually be a trigger from an event that's happened. So as an example, somebody with a tree pollen allergy, it was actually down to being bitten by a dog under a beech tree at the time when the pollen was around, and the trauma and the shock of that being bitten by the dog and the tree pollen becomes connected within the body, and the body thinks it's protecting you. Hang on, there's tree pollen, where's that dog? So, but it's that it comes out as physical symptoms that aren't nice to be experiencing. The one that for me was always the standout one, this was more when I was training on the site, this is on the PSYCH-K side, was there's somebody in the room that had already done the health and wellbeing course before, and they said, oh yes, I worked with my husband on this, who was he didn't believe in this approach, but he had really, really, really bad hay fever, and she just said, please, do you mind, would you be just open to just trying? So they said, okay, fine. And it came out that it was an event that happened when they were 8 years old, and they were like, oh my God, pardon the choice of words there, actually. So it was that they went to a convent, and they hopped over the fence from the playing fields into the meadow, but that had all of the wild flowers and the grasses, and they were caught by the strictest nun in the convent for being the wrong side on the playing field. And it was the days when caning happened, and so they were all caned for being naughty and going into the field. But their body put together the being caned by a nun and all of the grass pollen and everything else. So there, it wasn't hay fever, it was an allergy to nuns, essentially. And then by releasing that, then yeah, the hay fever is no longer triggered. So yeah, there you go.
I'm tempted not to say it sounds like a sketch from the Monty Python, but that is incredible, isn't it? And yeah, and how that association just hangs on. And I have comparisons, the work that I do, because this whole timeline, lifeline thing, and experiences and messages that you get when you are younger, it's amazing how long they stick with people. I was talking to a client the other day, and without going into too many details, she could remember something that her mother said to her when she was 6, which related to her body and how she was eating. And she is now nearer my age, which most of you will know is 60. And there were still times when that voice was in her head. So where she was hearing and allowing herself to act on that message from being 6. So we went back and we said, okay, so what is, let's call her Matilda. What is Matilda thinking? What she feel? What would you like to say to Matilda? And it's quite an emotional moment.
Yeah.
And we try to look at what went before, look at what went immediately after. And this is an NLP technique, but it's very, very similar, isn't it, to this understanding of events and how things just stay locked in. And we just broke it down. And then we tried to then move forward with a different thinking right through to where she is now, so that voice doesn't have anywhere near the power, or she's able to say, oh yes, okay,
I recognize
this, thank you very much, I'm now whatever she is, 50, 57, and I'm going to do this instead.
Yeah,
I don't need to act on this, but thank you, kind of thing. And it's it is just amazing how much of a filing cabinet the subconscious mind is, all those memories, and yet they're still, you know, it's almost like if you had a very special X-ray machine, you could see all the lines, all the connections inside drawn, you know, in addition to all those veins and neurological systems that they're all there. We just need to identify them, don't we, and get the wire cutters out and sort of chop them, and so that they lose their potency.
Yes, and it's the kind of the important thing to understand is that the subconscious, there's two things really. So the subconscious mind is more, it's just constantly on. It's more powerful than we realize. It's just the processing power of it is incredible. And you know, it's the reason I can be breathing, talking,
exactly,
digesting my breakfast all at the same time, not thinking about it. But your subconscious mind is there to keep you safe. It's not there for you to be happy, to achieve your life goals. It knows what it knows. It's recorded, it's held there, it's fact. This is the way things are, or this is what happens in these situations, you know, whatever the associations or perceptions are of your subconscious mind. And the reason why, and it's just active there behind the scenes, you don't always know, but up until about 8 or 9, we live our lives in a hypnotic state. So everything is being recorded and filed directly into the subconscious mind to keep us safe. Yes. And you don't always remember those things. Sometimes you do, sometimes you don't. And accessing those files, finding out what they are. But the great thing with the subconscious mind, it doesn't hold a judgment about it, it's just holding it. So you find a technique that can remove that file and replace it with the good one, then things just change. So yeah.
Yes. And then in your world, that can then unlock a physical symptom, because that's where that connection is being held. So what you do, Rachael, it's incredible, because you're just tapping into all these different areas. So it touches on the practical hands-on and the kind of physicality, but there's also a sense of, and my word not yours, but there's quite a strong healing element to it, because you're looking at the whole body relationship and asking questions, and it's very impressive.
I love it because, like I said at the beginning, I'm just an interpreter. So yes, I've got my learned knowledge, and I need to know where to head in certain directions. But with the PSYCH-K side, actually, it's just about holding that space for somebody, hearing about how things are, how you want things to be, and then it's the process does the rest. You do the rest as the person receiving the. It's not that you do the rest, but the answers are all there. It's just a case of being able to access them. So that's what I utterly love. Is okay. This is how things are. This is where we're aiming. We're going to work together. Do the best. Okay. What needs to happen? Let's do it.
And would you? Well, I suspect the answer to this question is yes, but would you like the medical profession to be more open to referring to complementary facilitators like yourself? Because I know there's something called social prescribing, isn't there, where patients can be referred to have other treatment. Is that something that you'd like to see more of? Is there anything that you think should happen to?
I think there's an element of things are changing. There's more and more doctors training within functional medicine and things like that, so which is excellent, because actually even just at the point of the doctor seeing the patient to be considering everything as just being commonplace would be absolutely fantastic. But no, I would for sure. Yeah, it's a bigger conversation. But it is. It'd just be incredible to always consider everybody every time on all levels.
Yeah. And I think that those of us that have experienced it, it's about us talking about it, isn't it? Talking about it to friends and saying, "Oh, try it. Well, what have you got to lose? Just go for an hour. You feel awful at the moment, so you can't feel any worse. To put it in very sort of blunt terms, just have a go, and at least you can have it a bit sooner, and you might not actually need to go and see a doctor at all, or it might just go hand in hand, because often these complementary elements do go hand in hand, don't they, with orthodox medication, and that's fine as well.
That's it. Yeah, no, definitely. I mean, within kinesiology or with supplements, there's certain supplements you wouldn't have with a prescribed medicine, but other than that, yes, 100% they work. There's people that I'm seeing that are taking prescribed medications and may or may not be also taking supplements. So I mean, the big message really is, just I suppose with having the open mind that there are choices out there, and to know that there are choices, and that if one thing hasn't helped does not mean that you are a lost cause or there's no help that is going to be possible. Just keep the open mind, find out what's out there, go with what feels right for you at that time, and just try it. And if it hasn't worked, well, that's one thing that there's ticked off the list, and okay, what's next? So just know that things can be better. Definitely.
Yes, lovely. So I'm sitting at home with my tennis elbow, and I'm thinking, do you know what? I'm gonna have a go at this. What do they call it? Systematic Kinesiology PSYCH-K. Yeah, I'm gonna have a go at this. And I heard that very lively, bubbly lady on that podcast. Where do I find Rachael and or Lorna? Let's not leave Lorna out. How do we find you if we want to explore more, Rachael?
There's the website. It's allabouthealth.co.uk,
which is new and shiny, isn't it?
Absolutely. Yes.
It's been upgraded. Exciting. Yes. It's allabouthealth.co.uk. Okay.
Yeah. And then otherwise, as far as, like I said, there's the work, doesn't matter where you live, can happen online. Otherwise, in person, then we're in Somerset, a place called Kingsbury Episcopi.
Try saying that after too many coffees.
Yes. So I suppose the nearest big places to say would be we're in between Taunton and Yeovil.
Okay, lovely. Lovely green rolling hills. Beautiful. Lovely. Oh, Rachael, time flies when you're enjoying yourself. Thank you so much for joining us and explaining a topic which I think is less well known in the area of complementary medicine, functional medicine. So really, really helpful. Thank you very much. And I will put all the details in the blurb. If you're listening, thank you. Hope you've enjoyed it. If you're watching, equally, I hope you've enjoyed it. Please do follow on the podcast. Please do subscribe if you're on YouTube. And I will see you next time. Cheerio.